Hello guys, welcome once again to my YouTube channel A.Define Pharmacy. Yes, let's today solve October 2021 question paper. Important question paper of Pharmaceutical Chemistry 2, that is our old syllabus 1991. Okay, let's start with some of the important questions and answers. First one is define analgesic and antipyretic structure of pethidine. Okay, structure of pethidine. Example, you know that what are these analgesic? Analgesic are the class of drugs that are used medically by patients to relieve pain without causing a loss of consciousness. Here just these are giving to reduce the pain without loss of consciousness. Example is aceclofenac, diclofenac, ibuprofen, naproxen, anyone. Then antipyretic, it is a substance that reduces fever. Okay, you can write substance or you can write medicine or drug. Example is paracetamol. Now they have asked a structure of a pethidine. See, this one is the structure of pethidine. You have to practice once or twice, then you will perfect here. Next, write the structure and uses of paracetamol and propranolol. See, paracetamol, it is used to reduce fever, and this propranolol means it is used to treat the heart disease, and it is used to reduce the edema, swelling, inflammation. Okay, swelling means if there is a water retention in the legs and all, at that time we are giving this one propranolol. These are the structures. You have to practice these structures. Then write a note on diagnostic agents with example. See, diagnostic agent means what? These are the chemicals or substances used to detect the abnormalities in tissues and organs, or to test on organ function. Mainly these are the testing agents. Okay, why we are using? To check whether the tissue is to check the function of organ, tissue, cell. Okay, and these diagnostic agents, they are not having any therapeutic value. Okay, they do not have medicinal and pharmacological effects. X-ray film used for the radiography. You know that X-ray machines, if any fractures happen or if any bone fracture are observing, no, what they are doing? They are just X-raying, means radiography. What we are telling, X-ray film, X-ray, what you are telling, no, X-ray. Why we are using X-ray? X-ray is used to know the fracture. Then examples, angiography. Okay, these all are the diagnostic agents, like arthrography, bronchography. Example, you can write 3 to 4. Write a note on cotrimoxazole. See, what is this cotrimoxazole? It is an antibiotic. Cotrimoxazole, it is a fixed dose combination of a trimethoprism and a methoxazole is called a cotrimoxazole. Trimethoprism, okay, is a diaminopyrimidine related to the anti-malarial drug pyrimidine, which selectively inhibits the bacterial cell wall. Just to remember, what is this cotrimoxazole? It is a combination of the trimethoprism and the sulfamethoxazole, and this here it is mainly used to malaria, treatment of malaria, where it will defeat the cell wall. This you remember. Then mechanism of action, it is a bactericidal. It is a bactericidal. That is it block the folate metabolism. Trimethoprism, they will inhibit the bacterial cell wall synthesis. Sulfamethoxazole, they will inhibit the bacterial dihydrofolate reductase. Okay, means folate metabolism. They block the folate, means they block the metabolism process, they block the chemical process, they block the cell division of these bacteria. That's why this which one? This means that why this cotrimoxazole, it is used as a very good antibacterial agent, and is also active on Salmonella typhi, Serratia, then Enterobacter, Klebsiella, etc. Adverse effects. See, these cotrimoxazole adverse effect here is they can cause megaloblastic anemia, blood dyscrasis, renal disease in elderly, bone marrow toxicity. Uses is it is used in urinary infection, respiratory tract infection, typhoid, bacterial diarrhea, and dysentery. Write the structure formula for quinine, pyridine, furan, indole. See, these you have to practice. This is the structure of quinine, pyridine, furan, and indole. Easily you can remember these three. Okay, pyridine, N is there, furan, O is there. Okay, then indole, NH is there. One benzyl ring is there. To that 1, 2, 3, 4, 5 member ring is attached. easily remember. Write the stability and storage for benzyl penicillin caffeine. See, caffeine is stable for 3 days at room temperature, and caffeine may react with oxidizing agent. Benzyl penicillin is stable at least for 10 days. Okay, these all are the stabilities of there, and you have to store in a cool place in a well closed container, both either caffeine and also the penicillin. Then write the uses and the following which one? Urea they asked, piperazine, then chlorocresol, ephedrine. Uses for urea, it is used as a fertilizer and feed supplement. Piperazine, it is used in the treatment of worm infection. That's why we are calling this anti-worm or deworm syrup is there, no? Piperazine available in the market. Then chlorocresol, there is phenol, it is used as an antiseptic and potent disinfectant to kill the microbes. Then ephedrine, it is used to treat the hypotension, used in the allergic conditions. Ephedrine, that's called adrenaline, noradrenaline. Yeah. Write the causative organism for TB, okay, and malaria, and mention 2 drugs for treatment. Causative organism for TB, that is tuberculosis, is a mycobacterium tuberculosis. Drugs we use here is ethambutol and rifampicin. Causative organism for malaria is it is caused by the malaria, that is it is caused by the parasite known as female mosquito. Drugs like chloroquine and hydroxychloroquine. 10th, classifies semi-synthetic penicillins. What are these semi-synthetic? In the name itself indicating semi means these are not natural. They are mixed. They are half natural and half synthesized. Semi-synthetic. They are produced by chemically combining a specific side chains. Okay, or they are incorporating specific precursor in the mold culture. Just we are preparing this in the laboratory. Semi-synthetic, it is prepared in the laboratory with the mold culture. Culture medias are there. See, many culture medias are there. Liquid culture media, solid culture media. In 3rd semester you have learned that all culture media. In that culture media we are culturing the growth of the particular bacteria. Penicillin is also bacteria, yes or not? Classification. Here some classifications of a semi-synthetic penicillins, like acid resistance, penicillinase resistance, then extended spectrum penicillins. Example is phenoxymethyl penicillin. Here methicillin, cloxacillin, dicloxacillin. Remember these, at least 2 examples remember. Write the structure of any 2 local anesthetic agents. See, some local anesthetic agents are using here. Now which are those? First you write what are these local anesthesia. See, local anesthetic is a medication that causes absence of all sensation, means they will stop the all sensations including pain in a specific body part without any loss of consciousness. Here our consciousness is not lost, our consciousness is the same, but here what happens main here is they will block the neurons, they will numb the pain side. Okay, this is the major difference between the general anesthesia and local anesthesia. General anesthesia means they will make the patient unconscious. Here no, without loss of consciousness. Procaine, it is a structure. This is a benzocaine. These both are the very good local anesthetics which are used majorly in hospitals. Now what are antidepressant drugs with example? Antidepressant drugs, they helps to relieve the symptoms of depression such as low mood, irritability, feelings, okay, restlessness, anxiety. Antidepressant, there are types: monoamine oxidase inhibitor, example is selagiline. Then tetracycline antidepressant, example is mirtazapine. And tricyclic antidepressant amitriptyline, example. 13. What are the therapeutic uses of lignocaine, azathioprine, atropine, and phenopharmine? See, somewhat we discussed here. Phenopharmine, you know that it is the hypoglycemic agent to treat the high glucose level. Atropine also you know, lignocaine also know, local anesthetic. Simple. Lignocaine used as a local anesthetic agent. Then azatropine, it is used as an immunosuppressive. It is a SUPP, suppressive. Immunosuppressive medication means just they will suppress the excited immunity, like it is used in rheumatoid arthritis and many other condition. Then atropine, it is used to treat certain type of nerve agent, like to decrease the saliva production. Fenformin, it is an hypoglycemic agent which is used to treat the high sugar level. Okay, session B, it is repeated in 2022 September, means here session B, our question number 14 in that A is repeated. So I am not wrote here. Repeated questions I am not wrote because no need to waste the time. Already we discussed in the September 2022 question paper this question. Okay, if means you go and watch that one, very important lecture. And what are diuretics? Classify, use and structure of furosemide. Diuretics, they are called water pills, medications designed to increase the amount of water and salt expelled from the body as urine. Means here water and salt, what these furosemide or diuretics are, they are doing, they are expelling the salt and water from the body, so that there is no chance of inflammation, edema. Classification: thiazide diuretics, example is hydrochlorothiazide. Loop diuretics, example furosemide, torsemide. Potassium sparing diuretics, spironolactone. These are the example. Then write a note on antileprotic agent. Here one more question is there, sorry I not wrote that one. See, classify they told, but uses and structure of furosemide I not wrote. Better you go for furosemide, you can search in the which one, that is Google. But uses I will tell here, it is used to reduce the edema. It is also used to pulmonary edema. It is also used to reduce the high blood pressure. These are the uses. Write a note on antileprotic agent. See, antileprosy, lepro in the name itself indicating it is a class of drugs used to treat leprosy and certain skin infections. Okay, it is caused by the slow growing type of the bacteria called Mycobacterium leprae. Some of the drugs like sulfones, phenazine derivatives, anti-tubercular drugs, these are the examples. Other antibiotics like ofloxacin, moxifloxacin, clarithromycin. Dapsone, it is one of the simplest and oldest and cheapest, most active and most commonly used type of the anti-leprotic agent. And this here, what is the mechanism of action? Leprostatic, even at low concentration. Higher concentration arrest growth of many bacteria, other bacteria. Means in low concentration what they will do, they will stop the growth of this bacteria, but in high concentration totally what they will do, they will arrest the growth of the bacteria. Chemically related to the sulfonamides, some mechanism, they will inhibit the incorporation of PABA into the folic acid, and specificity to M, that is Mycobacterium leprae. Then affinity for folate synthesis. Doses for acute infection, so toxic. Just remember the mechanism of action, what they will do, they will kill the bacteria, or they will stop the growth of the bacteria. This remember. Define sedative and hypnotic structure. Chemical name, uses of phenobarbitone.glutethimide. See, glutethimide. See, sedatives are the drugs that decrease the activity and have calming, relaxing effect. People use these drugs mainly to reduce the anxiety. At higher doses, means sedatives usually cause sleep. Okay, but here drugs used mainly to cause sleep are called hypnotics. Only one difference between sedative and hypnotic. Sedative, these are the drugs, okay, we are giving to relax, to sleep, means to make the patient calm without sleep here, which one in sedative. Hypnotics means it is a forcing to sleep. The hypnotics, hypnotize, what we are telling you. Uses means it is used as a sedative. Chemical name, it is used chemical name for this phenobarbitone is 5-ethyl 5-phenyl 1,3 diazanine 2,4,6 trione. This is the chemical name for phenobarbitone. This one is phenobarbitone structure, this one is glutamide structures. These both are used for the sedative and hypnotics. What are cholinergic antagonist? Classify structure and uses of propenicillin. See, cholinergic antagonist means these are the agents that bind to cholinereceptors, example muscarinic and nicotinic. They will prevent the effects of cholinergic agonist, okay, like of acetylcholine. What the main function of acetylcholine? Acetylcholine, it will decrease the heart rate. Okay, this one cholinergic antagonist, what they will do, they will stop the function of this acetylcholine. Simple. Anti-muscarinic agents like atropine, cyclopentolate, example. Then ganglionic blockers, neuromuscular blockers. These are the some classifications of cholinergic antagonist. Uses of propanithin. See, propanthalin bromide is an anti-muscarinic agent used for the treatment of excessive sweating, that is hyperhidrosis, cramps, then spasms of the stomach and intestine. Mainly, it is observed in the female. Is very popular in female cramps and all. And this is the structure of propanthalin. Go through this structure. Yes, note here, skipped questions are repeated. Those questions which are skipped, they are repeated means in the other question papers which I had made the video. So video is very important. Share with your diploma in pharmacy students, and don't forget to subscribe our channel A.Define Pharmacy. Thank you.